Hello, this is Dr. Trivedi, doctor working in this clinic. May I confirm your name and age, please?
Hi, doctor. My name is Jennifer Aniston and I am 67 years.
Okay, how may I address you?
You can call me Jennifer.
Okay, Jennifer, today we are going to discuss about your health issues. Is that all right?
Okay, doctor.
During our conversation, I might take down some notes which will be strictly confidential. Is it okay?
Okay, doctor.
Okay. Well, now, Jennifer, can you please tell me on your own words what have brought you here today?
Actually, I visited my GP because for the last couple of months, I know I am feeling that I am becoming exhausted more easily. I am becoming more fatigued day by day. And also, I noticed that I cannot do my jobs like before. So I thought at first that it might be due to some changes in the weather, or there may be some changes, there may be some stress in my life, so I am having this. But this symptom is increasing day by day. So I visited my GP, and
Hmm.
he then did some test and said that my blood level is very low, and also I have some problem with my kidney. So for better evaluation, he sent me here that he thinks that my kidney is not working properly.
Okay. Uh, well, I will try my level best to find out the cause, what is troubling you. Can you please tell me that when did this exhaustness or fatigue actually started developing?
Maybe for last 5 or 6 months.
Okay. Well, can you please tell me that did it come along suddenly or gradually?
Gradually, doctor. Initially I didn't pay heed to it, but it is increasing, and it has increased so much that even I cannot do my own jobs properly. I cannot go to market or cannot walk more than 100 meter. I feel exhausted.
Okay. You feel exhausted. Okay. Is it present all the time now, even at rest, or just when
Not
you
at rest.
do
I
some
feel
work?
I feel better at rest. But when I do something, or I start hurrying for something, then I feel this.
Okay. Okay. Well, is there any day-to-day variation or variation within the day of your
No.
symptoms? Or okay, okay. And is it present almost every day now?
Yes,
Or
doctor.
okay. And may I know that do you feel any? You tell that you feel exhausted. What do you mean by feel exhausted? Do you feel any shortness of breath or anything like that?
I can tell you that I don't feel much energy like before. I am less
You
energetic.
can. You're less energetic. Okay. And do you feel any chest pain?
No,
Any racing and pacing while
no, no,
feeling exhausted? Okay. And okay. And have you noticed that there is any swelling of your legs?
no,
Okay. Okay. And do you have to use extra pillows at night to feel more comfortable?
no.
Okay. And okay, that's all right. And do you you told that your blood level was low actually? Uh, could you did anyone notice that you were getting pale day by day, or did just the GP notice it?
My husband said that I am becoming pale day by day, but I didn't pay attention to it.
Okay. May I know that when did he notice that?
Maybe for last 3 months or 4 months.
Okay. Okay. May I ask you some questions now? Do you have any weather preferences?
No,
Okay. Any changes in weight?
no.
Okay. May I ask you some private questions? I think you have stopped menses. Am I right?
Yes, doctor, absolutely.
Uh, may I know how long before?
At my age of 48, that was around
Okay,
20 years.
that's all right. And okay, and may I know that do you feel any dizziness while standing from sitting position?
No,
Okay, any color changes in your skin?
no,
Okay. Well, may I know that do you have any headache?
No.
Okay. Any changes in your vision?
No.
Any hair loss?
No.
Any soreness in your mouth?
No.
Okay. Any joint pain?
Not joint pain, but I have pain on my leg, on my right leg. About 18 years ago, I had a bad road traffic accident, and my femur was fractured at that time. And after that, during that time, I needed hospital admission for 3 months. After coming back, my pain persisted, and even now, sometimes I feel the pain.
Yeah, I can get it. I'm very sorry to hear that. Well, okay, and we will get to it later on. Can you please tell me that do you have any okay? Do you have any difficulty in your swallowing
No.
or speech? Okay, any weakness in any parts of your body?
No.
Any abnormal sensation in any parts of your body?
No.
Okay, may I know that have you ever lost consciousness?
No.
Okay, that's all right. And may I know about okay, and may I know that do you have any raised temperature?
No.
Okay, and what about your water work? Has it been all right?
Yes, I haven't noticed any signs.
Okay, have you noticed that is there any frothiness in your water work?
No.
Okay, have you ever noticed any redness in your water work? Any redness or any blood?
No.
Okay, and do you have to go for your water work more frequently? Have you noticed?
Yes, doctor.
Okay, may I know for how long?
For last about 3 months.
Okay, how frequently do you have to go for your water work?
Uh, about 8 to 10 times a day, and even at night, about 2 to 3 times at night.
Okay, even at okay, I can get it. And okay, and okay, that's for 2 to 3 months. Am I right?
Yes.
Okay, that's all right. And may I know what about your bowel movement?
It's okay.
Okay, and have you ever noticed any episode of loose bowel, loose motion, or anything like that?
No.
Okay, any blood in your bowel motion?
No.
Okay, any lumps and bumps anywhere in your body?
No.
Okay, and okay, and how about your eating habit? Have you your food habit? Is it all right like before, or has you increased taking food or anything like that?
I think that I feel less hunger than before.
Okay, that's all right. And may I know that do you know yourself of any significant history like high blood pressure or
Yes,
diabetes or
doctor.
anything like that?
I have high blood pressure that is around for about 15 years. And I am taking two medication, Remifenil and amlodipine for that.
Okay, may I know that when where this medication started? Both started at the same time or one after another?
No. First, they started Remifenil, and about 5 years ago, they started amlodipine.
Okay. May I know that what is their doses, or may I have a look at the medication chart?
I am taking Remifenil for 5 mg and amlodipine 5 mg, both at night.
Okay. Has there been any recent change in your medication?
No.
Okay. And okay. And are you taking those medication regularly?
Actually, doctor, I don't feel much problem with my blood pressure because I heard that patients with blood pressure have some changes in their vision, have some neck pain, feeling of being unwell. I don't feel those problems, so I usually don't take this medication regularly. When I feel bad, I just take this medication.
Okay. Okay. I can get it. I can get it. And okay. And okay, that's all right. And may I know that Do you have any problem with your blood sugar level or any diabetes? Do you need know of any?
No.
Have you ever checked it?
No.
Okay, you have never checked diabetes. Am I right?
Yes.
Okay. And have you ever felt that there is any leg cramping pain in your legs while walking?
No.
Okay. Okay. And well, let's get back again to your disease condition. That you told that you take Ramipril and uh, amlodipine. Any over the counter medication other than that?
Yes, doctor. For my
May I know?
pain, I told you that I felt this pain after my accident. I take
Yeah.
ibuprofen.
Okay. And for how frequently do you take this?
Whenever I feel the pain, and for the last 2 years, I am feeling this pain more frequently. Sometimes about 3 to 4 days a week.
Okay. And how many tablets do you take usually? This ibuprofen tablet?
When I feel more pain, I take 2 tablets.
2 tablets. Okay. And has okay. And there been any overdose any times that you have taken more than 2 tablets at once?
Maybe once or twice to control my pain.
Yeah, that's all. That's all right. Well, any other medication
No,
apart from this? Okay. And any herbal medication?
no,
Well, I'm sorry to ask, but may I know that do you take any recreational medication? It's actually a
no,
personal question.
never.
Oh, yeah, that's all right. Again, some personal questions. Do you smoke?
I smoked, but I stopped that about 5 years ago.
Okay, that's very good. And do you drink alcohol?
No,
Okay. And okay, that's all right. And do you drink? Sorry. Well, may I know that do you drive?
no.
Okay. And you do have any history of blood transfusion?
Yes, doctor. During my fracture, I needed 1 unit of blood transfusion.
Okay. And since then, did you have any blood transfusion?
No,
Okay. Well, have you ever faced that any yellowish discoloration of your skin or something like that?
no. 2 minutes remaining.
Oh, okay. And well, have you been to travel to any other country recently?
No,
Okay. And okay, that's all right. Well, what do you may I know what do you do for a living?
I am a retired person.
Okay. Are you well supported financially?
Yes, doctor.
May I know whom do you live with?
I am living with my husband.
Okay. And may I know that what your concerns are?
Why I am having this type of fatigue, this weakness, and also is my
Yep.
kidney damaged?
Okay. Well, actually, at this moment, I have to examine you properly and also run some tests, both blood tests and also scanning tests. And after getting the results, I can give you a much more better explanation of what is causing your symptoms. But as long as I've taken your history, I think there are some probabilities that it might be that your kidneys might have been involved in this case, in your case. There might be some causes behind it, like you're actually have not been under regular follow up for your high blood pressure, and at times this high blood pressure can cause problems in your kidneys, and also you some of your symptoms actually go in favor of diabetes. So that can also be a cause. We have to find out whether you have diabetes or not, and specifically your painkiller intake, ibuprofen intake. Uh, this ibuprofen when taken for a long time can cause damage to the kidneys. So actually at first we will have to do the examinations and also some tests, and we will also involve the kidney doctor, and after getting the test we can be much more sure about what is causing it, but it's more likely that it's that your kidney is getting damaged. Are you getting me?
Okay, doctor. Is there anything that can reverse my condition?
At this moment, at first we have to look into the results, and then we can find out that at which stage it is, and whether our speculation is correct or not. And after that, we can get to you with a much more better plan. Are you getting me? And
Yes, doctor.
any more queries or concerns?
Do I need any blood?
Yeah. Well, actually, uh, at this moment, the we have to at first evaluate you properly, that whether you need any blood or not, or sometimes some other medication can also improve your blood level. Okay, so we have to evaluate you at first.
Okay,
Is that
doctor.
okay?
Okay.
Okay. Thank you. Yes, Jennifer.
Okay. So, what do you think? What is the cause of her fatigue?
I think that this fatigue is more probably due to his anemia caused by renal damage, chronic kidney disease, and I have here some probabilities for her chronic kidney disease, that actually hypertension, uncontrolled hypertension, and also medication overuse, actually, which can cause interstitial nephritis, I think. And I think she might be suffering from diabetes as also. So these probabilities might have caused damage to her kidney, CKD, and this might have
Why do you think
caused.
she is suffering from diabetes?
Well, because of her nocturia, I think she has said that she has to go for her water work more frequently, even at night time. So this might be a possibility.
Cannot chronic kidney disease cause nocturia?
Yes, it can cause, but I think yes, this can cause.
Okay. So, do you think that you needed any special attention or any special advice to be given to the patient?
Uh, yes, for this, actually, uh, some specific special attention have to be given. First of all, we have to educate and counseling the patient, and then um, we will have to actually counsel her for taking her medication regularly, because she is not taking her medication regularly, this ramipril and amlodipine, and also she has not been on regular follow-up. So it is also important that she goes to her GP regularly and keeps her follow-up regularly. And regarding her ibuprofen, we must involve the rheumatologist to find out whether any other medication can be given, or what to do about her pain. um, uh, so I think these are the things that should be done.
Okay. How will you investigate her?
Well, first of all, I will have to do some routine investigations like CBC to find out the level of anemia. Actually, it's given here, and also ESR and CRP, CBC with ESR and CRP. Then I will have to go for urine routine microscopic examination to see the proteinuria level. How is the proteinuria? Then I may have to go for albumin creatinine ratio, and then for serum creatinine, it's already been done here. I might have to repeat again. And then I should go for some scanning test, ultrasonogram of the both kidneys, actually, ultrasonogram of kidneys. And uh, okay, and ultrasonogram, and then I might and then mm, I might have to do some other tests like serum lipid profile, serum uh, iron level, and also blood glucose level, and also some ECG, chest X-ray, echocardiograph. I think this should be done, and also some autoimmune profiling can be done. ANA level, these things.
Why all those at this stage?
Uh, well, I think Well, I think that first of all, the complications, because at first to know about the current kidney status, and then also the complications of hypertension. I think these need to be evaluated as well, because she has not been under regular checkup. So that is also important, I think.
Okay.
Okay.
For this lady, your approach was fine. I cannot
Mhm.
point out anything that you missed because you have taken
Yeah.
history and tried to rule out that why she is having this type of weakness, and also for her anemia if she has developed any complications, you have also excluded that. And one
Yeah.
thing that I think you could have asked that, did she ever had any kidney test before, and
Yeah. Yeah.
was
Yeah.
there
Yeah.
any
Yeah.
problem?
Mm-hmm.
Any other test,
Yeah.
like any blood test, any other test of his water? Was there any abnormality?
Yeah.
If she knows
Yeah.
any of those.
Mm-hmm. Mm-hmm. Yeah.
Otherwise, this was fine.
So what were the cases here? Causes hypertension, CKD due to hypertension, and CKD due to interstitial nephritis. These two main differentials.
Yes.
Okay. Okay. So I think that's more or less done in this
Something
case, right?
needed about her, some counseling, that why she is not taking this medication. So you could give some advice that it is
Yeah.
necessary to take this medications regularly. And
Yeah. Yeah. Yeah.
you excluded all the secondary causes for raised creatinine
Weakness.
level, and also
Yeah.
secondary causes for her low hemoglobin level. That was fine.
Yeah. Yeah. Because I excluded travel history to exclude malaria or something like that.
But
Then transfusion history.
the one thing that any
So
recurrent episodes of fever or raised temperature that rule out recurrent infection.
yeah. 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 That is also very, very important.
Yes.
Okay.
And this may be a case of carcinoma, so you could have asked that.
Frequent episodes of fever or what?
Recurrent episodes of infection and
Yeah.
any bleeding manifestation, that is for any cancer.
Yeah. 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 Okay.
Otherwise, this
Okay.
was fine.
Okay. So I
Okay.
think this recording can be stopped.